This is the palpation portion of Riot's exam 2 weeks after the stem cell procedure. You'll notice as I palpate down his back that there's very little pain and discomfort. He's actually more annoyed with me holding his head than anything else. There are no muscle spasms, tenderness, or trembling as we go up the spine or down the spine, even between his shoulder blades where he's most uncomfortable before. Here, obviously, he still has very little resistance to manipulation of his neck and is very comfortable in any direction we move him in. Here we're looking at Riot's stance. He's bearing even weight on both front legs, and we're going to spin around to the back where he's doing the same there. Here we're going to palpate Riot's joints. This is his left shoulder, which was actually a more uncomfortable joint during his first palpation. You're going to notice he still has some limited mobility, but his discomfort is far less. He's not trembling, he's not yelping or vocalizing in any way, and eventually does let me get through the full range of motion with both his shoulder, his elbow, and essentially his wrist area there. Again, very comfortable and very little resistance once we've gone through it once and he's warmed into it a bit. No pain as I palpate his muscles. Here we're going to go to his left rear leg, which again was one of the more uncomfortable joints, specifically his knee. He's letting me extend his knee fairly vigorously there and palpate the muscles at the same time. Flexing is no problem at this time. Here he's letting me manipulate his hip very, very comfortably. Here we've gone over to Riot's right side. You can see the incision in his belly there. He's very comfortable as I palpate his right forelimb, much more so than the left actually. That's an extremely good range of motion for a corgi there. He is not uncomfortable as I palpate the muscles. There's no trembling or anxiety, no vocalizations. Here we're going to manipulate his right hip, which is a little more uncomfortable than on the left side. He did have an injection on the right side in his hip, but he's still letting me get full range of motion, although he's uncomfortable at the extent of both flexion and extension. Here we're able to abduct his hip though very, very well.